Cases rise once again. Public health providers say this is now a virus of the unvaccinated.
They're especially concerned about young teenagers who are hesitant to get the shot. This morning, Local 12's medical reporter Liz Bonus explains why.
Hey there, everybody. Hello to you. One of the top groups right now for choosing not to get vaccinated, teenagers ages 12 to 15. As students head back to fall sports and classes, infectious disease specialists say this is especially concerning.
The first reason it's concerning, about 1% of kids, even in this age group, who are not vaccinated and get COVID-19, develop that severe inflammatory response known as MIS-C.
I know it doesn't sound like a lot. 1% is a very small number, but when you're talking about healthy kids running around and then boom, they're in the ICU on a ventilator, it's scary.
The second reason it's a concern, the Delta variant.
Some of the studies suggest that the Delta variant is highly infectious to children and may actually make children more ill than the original COVID.
The third reason it's concerning, teens like to hang together. So there's some thought that the Pfizer and Moderna vaccines, known as mRNA vaccinations, are the best way to protect teens when in many settings they can't help but share air.
And there's really nothing different about the immune response to an mRNA vaccine than it is to any other vaccine, whether it's an adjuvant vaccine or a killed virus or a weakened virus vaccine. They all do the same thing, which is to activate those B cells and T cells to make us immune to future infection.
Finally, the fourth reason for concern, there's a lot of misinformation among those choosing not to get the vaccine about side effects.
We see a little bit of, arm soreness. We see some headache and fatigue in some children, but it's been very well tolerated. And overall, the side effects from the COVID vaccine are far less serious, far less concerning than having COVID itself, even as a child.
Now, of course, getting the vaccines into a pediatrician's office, that is the next step. It does invite questions in a confidential setting. I'm medical reporter Liz Bonus. Now back to you.